My name's Georgia from BN Australia, and today we're going to talk about how to use our pelvic floor weights. So pelvic floor weights, if you don't already know, are silicone medical grade devices that are inserted into the vaginal canal to help strengthen and tone the pelvic floor. Our set comes in a progressive sizing, so we've got 60 grams up to 120 grams, and that allows you to apply the principles of progressive overload. When starting out with your pelvic floor weights, we always recommend starting with the lightest size, so with the pink one or the 60 grams. And this will allow your pelvic floor and you to get used to the sensation of holding something inside the vagina. So as you can see, they're egg-shaped and they have a tail on the end. So this is the part that's going to stay on the outside of the vaginal canal, and this whole egg and pelvic floor weight is going to be inside the vaginal canal, about 2 to 3 centimeters inside from the entrance of the vagina, which will mean it's sitting above the level of the pelvic floor. Now, because these are covered in medical grade silicone, we need a water-based intimate gel or lubricant when you're using the weights, if you're going to use something to lubricate it for insertion, which we do recommend, just in order to preserve the material that it is made from. So once you've got your lube ready and once you've got your chosen size, you're going to lie yourself down on the bed or the couch somewhere comfortable. Wash the weight before you use it and wash your hands just with warm water and some mild soap, and then get some lube and put it on the end of the pelvic floor weight and maybe on the entrance of the vagina. Just be mindful of how much you use, because remember, we want the weight to stay inside the vaginal canal, so we don't want to make it too slippery so that it slides out once you insert it. Lying down in a reclined position, you've got a little bit of lubricant or intimate gel on the tip. We're going to separate the labia, and then the aim is to get it inside the pelvic floor or above the pelvic floor. So the weight is just going to slide into the vaginal canal. You're going to push it 2 to 3 centimeters inside the vaginal canal so that it's sitting above the muscular layer. Now, you might not be able to feel where the muscles are, but if you've inserted the whole pelvic floor weight into the vaginal canal and it's just the tail that's sitting out and it's comfortable, you've only got a mild awareness that it's there, then it's probably in the right spot. But you just want to make sure it's in far enough, you haven't left half of it hanging out, because that will probably fall out when you stand up from that reclined position. So you've inserted it 2 to 3 centimeters into the vaginal canal above that muscle bulk. Then you can either pop your undies and pants back on and stand up, or it's your house, so you don't have to. Once you're standing up, you then want to make sure that your pelvic floor muscles are retaining the vaginal weight or the pelvic floor weight. So in a standing position, it should feel maybe a little bit heavy or like something's going to fall out, but your pelvic floor should be able to tighten and squeeze and keep that pelvic floor weight in. The weight by itself provides the stimulus to the pelvic floor for it to contract. So you should then be able to walk around, maybe you perform some Pilates exercises or some yoga, or maybe your pelvic floor physiotherapist or doctor have given you specific exercises to perform. But what the weight will do is just give that extra resistance to the pelvic floor, so that over time you're strengthening both the endurance and the tone of the pelvic floor muscles. Once you're finished with your designated set and what you want to complete with the vaginal weight or the pelvic floor weight, we're going to remove it. So again, in a reclined position, or maybe you would prefer to be in a semi-squat position, we're just going to use the tail to remove it. So just gently, you're going to pull on the tail, pull it down at the entrance of the vagina. Nice deep breath in, make sure you're relaxing the pelvic floor, and then you're just going to guide the pelvic floor weight out of the vaginal canal. Give it a wash with warm water and mild soap again, and then store it in the bag provided or in your chosen place, making sure it's out of reach of kids or animals that might be in your house. There's a bit of nuance when it comes to using pelvic floor weights, and it's always best to be assessed by a pelvic floor physio or gynecologist prior to use. But if you do need more information or resources, you can head to our website, pn.com.au.